Good morning, viewers. Today, for the Mother's Day special, we have a very, very special guest with us, Miss Desta Aspa, who is a lawyer, very eminent lawyer in Denver, who's a partner in one of the prominent law firms there. And to discuss her medical condition, we have Dr. Saketh Guntupalli, who is a professor and division director for gynecologic oncology at University of Colorado in Denver. Ms. Desta was given a very life-threatening diagnosis during her second pregnancy. And to discuss that, the medical aspects, I want to ask Dr. Saketh, what was the diagnosis that was very worrisome for the family and as well as the doctors?
Desta was diagnosed with a condition called placenta percreta. And what happens is when a woman becomes pregnant, there's the baby and there's the placenta, and the placenta actually functions as kind of the lungs and the circulatory system and even the immune system as an interface between mom and baby. And it's absolutely vital to pregnancy. It's very commonly referred to as kind of the afterbirth. After a woman has her baby, it comes out afterwards. The placenta is incredibly important. But sometimes what happens is the placenta actually grows into the wall of the uterus and potentially through the wall of the uterus. And that's what happened to Desta. And that can be a life-threatening diagnosis because the placenta won't separate after the baby is born, and it can cause a massive bleed, which is honestly what happened to Desta in this case.
So the medical worry was that, she may have bad hemorrhage and if she goes into labor on her own and she's somewhere where she can't reach the medical facility fast enough, that could really be life-threatening for her and the baby, both, right?
Absolutely. Placenta accreta spectrum, or PAS, which is what we call this now, is one of the biggest causes of morbidity or complications in pregnancy, but it's also a big reason why some women die in pregnancy. And that's just a never outcome for any of us who practice obstetrics. This is a very, very serious diagnosis. And, Desta is our hero because she kind of really championed this and came through on the other end able to enjoy her baby and be there for her kids.
Yeah, we're really celebrating her courage and her family's courage. Desta, can I ask you at what stage of your pregnancy you were given diagnosis and what was your reaction?
Yeah, so it was at my 20-week scan. So that's usually where they send you if you have really good care and you're going to all your prenatal appointments, which is important. Then at the 20-week, you usually go do the full anatomy scan. Sometimes they send you out to a specialist to do that, and they measure the heart and look really closely at everything. And I just remember them sending sort of quiet, and then they went and said, "Well, we'll bring the doctor in." And the doctor came in and said, yeah, it looks like you have accreta. And so, as Dr. Guntupalli said, there's a couple different stages. So we weren't sure which of the three stages it would be. It ended up being the worst, but we weren't sure at the time. They said this doctor had the worst bedside manner ever. She said, "You're going to need a lot of blood. It's a really dangerous delivery, and we'll do our best to take care of you," basically, is what she said. So my husband and I were in complete shock. We walked out of there terrified. After Googling it, got even more terrified because we saw the mortality rates. And so it was a dark day, and the next few weeks were pretty scary.
So there was a lot of, trying to find out information on the internet, talking to
Mhm.
friends, and then seeing where would you get the best care, I would guess. Yeah. This is the
Yes.
second pregnancy, right?
It is. It is my first. I actually had placenta previa,
Wow.
which is where the placenta is basically just blocking the cervix.
Hmm.
And so I had a C-section, and I think Dr. Guntupalli can talk a little bit about that. But so I had scarring from that, and then in this, my second, is when this more serious condition came up. And just as you said, we spent the next few weeks calling and texting and emailing everyone we knew who was in the medical profession. So my primary care doctor, friends who were in the medical field and asking for referrals because we went to the gynecological oncology team that had been recommended to us. And we started interviewing surgeons, basically. We just didn't go with what we were told. We said, no, this is clearly a life or death situation here. So we're going to try to find the A team, right? Like, and for me to be an African American woman, I'm, like 4 times more likely to die in childbirth without this serious of a condition. So the cards were really stacked against me, it felt like.
Yeah, you're, highly educated, and you learned that the mortality as it is, even without these conditions, would be higher than, other race counterparts. So I think you did the smart thing, which I think other patients need to know, is to really, take care of yourself, be advocate for yourself, not just recommendations, but really connect with yourself, right?
Absolutely. Absolutely. We interviewed several doctors and I actually brought up the higher mortality rate for African American women to each doctor to see what their response would be. And most of them had no response. Some of them said, oh, I'm aware, like everyone knows those statistics, but didn't really have anything else to say about that. And then would say, we'll do our best to take care of you, is essentially the message we were getting. So my husband and I walked out of each of those discussions feeling really like this wasn't going to work out. Like we might have to say goodbye, honestly. And then, sorry. Then we met your son. And he was the first one to really talk more about the statistics. He was clearly very knowledgeable. And he talked about, of course, his experience in the field, which is the best in maybe the country, definitely this part of the country. And then he said, you're going to go home. And sorry, I didn't think I was going to get this emotional.
I'm sure you felt very let down, after going to.
Yeah, it felt like no one cared. And he said, you're going to go home with your baby, and there's no reason why any woman should die just because she's having a child. And we like danced out of the building into the Anschutz parking lot. Because it was the first day we felt like I was going to have a baby and live.
Oh, that's very nice. And, it's very natural to be emotional. My God, it's that not, it's so out of the ordinary. So, Dr. Saketh, can you tell me what were the challenges in her case, or in general? What are the challenges you have when you have, and what kind of preparation do you do?
So these are the toughest cases that I do. I'm basically a cancer surgeon. However, I'm an OBGYN, kind of first, and did my full training in it. So I'm pretty attuned to issues in obstetrics. And these are still some of the most difficult cases that we do, because the placenta is supposed to just separate, and here it's grown into the wall of the uterus, and sometimes in other cases into the bladder, the rectum, and so the dissection is very extensive. So blood loss is probably the biggest thing that we worry about. In Desta's case, she lost quite a bit of blood, needed a blood transfusion. And in fact, we were able to get the uterus out and she did great, but there was still a minuscule amount of placenta that was still left in the bladder that actually bled a little bit after, your delivery. And I think on the second day after she had her baby, we actually even had to do something called an embolization, where our radiology colleagues go in and they put a little bead just to cut off the blood flow to that one small area. And that kind of stopped everything. But, Desta's case was really tough. I think that she really advocated for herself, which is what we all want all women to do, is to advocate for themselves and, really do their research on what's the best thing for them and their baby or their situation. And I think Desta is really one of the best examples of that. And when she came in, she was so brave and she asked me a lot of pointed questions. But I think those questions are important because at the end of the day, she's her biggest advocate and patients are their biggest advocate. And but it was a tough case, mainly from the blood loss that you worry about and the such.
What's the average blood loss in a case like this?
So when I first started doing this about 14, 15 years ago, our blood losses were actually a lot higher. They were like sometimes 4 liters or 5 liters, which is, your entire blood volume kind of goes out. We replace it. We've gotten a little bit better because some of our instruments have gotten better because we've done a lot of research and there's some, things and techniques that we have that have made it a little bit better. But on average, we lose between 2 and 3 liters, which is,
That's a
40,
lot.
50, 60% of your blood volume. And, that's why pregnancy is,
Second
we
birth.
have to it's a second birth in some ways for a lot of women. You got to be just really on top of it. And we have a really big team. This is by no means just me. It's a whole team of surgeons and anesthesiologists and radiologists and nurses and trainees that are all part of this
Blood
process.
bank is a big part, right?
Blood bank is huge. I mean, anesthesia, blood bank we're constantly in communication in these cases.
Can I ask what is the highest number of blood you had to give units?
I'll never forget that case. That was a case that probably took maybe 1 year off my life. It was very scary. It was about 8, 9 years ago. Woman came in. She had a very bad percreta in the bladder and rectum, and we had to give her 30 units of blood. So her blood loss was on the order of 15, 16 liters. That's not the highest. That's just in my practice. The highest we've had, and that was pretty scary. I'm not gonna lie. That was a tough case.
So, I mean, you're pretty much replacing the whole blood volume many times over.
Right.
So, other than, I mean, I know you prepare with, with the blood bank and they're ready with, whatever number of blood you need. And what else can happen? Even if you replace the blood, are there other complications that can happen?
Sure. So one of the things that we see is, when we give a lot of blood to somebody, there are electrolyte abnormalities that can happen. They can develop, certain acid-base abnormalities in the blood, which prevent enzymes from working properly and prevent, the physiology of the body working properly because we're giving so much kind of foreign material. So there are a lot of electrolyte abnormalities. You can develop lung injury
They
from
can
getting too
bleed
much
also,
blood.
right? They don't clot like
Right,
no.
and they don't clot as well. So that's why we really, really rely on our colleagues in anesthesia and the blood bank because we're constantly checking labs. Like, is the fibrinogen level appropriate? Are the clotting factors appropriate? All these things. It's not just giving blood. You have to replace what the patient has actually lost, which are other blood products as well.
I mean, as a intensivist who dealt with a lot of OB cases, I can tell you that there's the amount of number of people around and everybody is doing their thing. I mean, I think generally people think that a cardiac arrest, in general, TV and all cardiac arrest seems to be the catching the attention of the general public. But this is something I can say that I've seen a lot of cardiac arrest. This is something beyond. It's probably 100 times cardiac arrest situation. The amount of coordination you need and, help you need, support. Of course, the surgeons and the anesthesia are the main players. Everybody else is support services. But it's just, I can't tell you how much of coordination it requires.
Mhm.
And so, Desta, when you woke up, how did you feel? And, I'm sure you were so groggy from long surgeries and everything.
Yeah, it was pretty complicated because when I woke up, um, I had to go to the ICU. So they tried to downgrade me to like something above the normal floor that you would be on after giving birth. So there's like a slightly higher level. And then I was there for about 5 minutes. I still remember they wheeled me into a room and they were like, oh no, she actually needs to go to the highest level. So moved me to the ICU and it was COVID. So it was December of 2020 and my husband couldn't be in the ICU with me. He was in the NICU with my daughter. So I was just texting with him and my family. And that night, the ICU just kept checking my blood and seeing how much I was losing. So it was probably like 24 hours. And then the next day, Dr. Saketh came back and we realized I needed to go do probably like a CAT scan or something to go find out why I was still bleeding. And then luckily with the dye and all the things that they use, they were able to identify the places because he said if we can't find exactly where the blood is coming from, then we just have to go back to the OR. And that was like no. I said, I can't go through this again. I can't imagine you opening me back up. So thank God they could see on my imaging where the blood was coming from so that I could go to interventional radiology and do a less invasive procedure to stop the bleeding. But I didn't actually meet my daughter until she was 4 days old because I
Oh,
was in the ICU.
and COVID, I mean, a lot of
Mhm.
lot was stacked against you at that time, huh?
Yeah.
But I think it highlights that it's a team process, right? Like the OB team does the delivery, and that's part of it, right? Safe baby. We always say safe mom, safe baby, so safe baby. And
Mm-hmm.
then the pediatrics team has to resuscitate the baby because your baby was born early.
Mm-hmm.
So the pediatrics team, and then we have to convert, and then mom usually tries to see baby. We try to let mom see baby for a few minutes, and then she has to go off to sleep. So we can do the hysterectomy. So then we're doing that, and then anesthesia and all the other services, blood bank, all the people in the operating room. I mean, we have basically two people just standing behind each surgeon in case we need something. Like if I need an instrument, they just run and get it. So we just want to move quickly but safely.
Can I ask you
Mhm.
what is the longest surgery on such cases you have done?
14 hours. That case that I talked about earlier, that's probably the second or third longest case I've done ever. That was a tough one. We started at 7:30 and we left. I think we actually left the OR around 8:30 or 9 that night.
Wow, I can't imagine just even standing, living
Mhm.
or doing something, you know.
Mhm. Mhm.
So that was that's quite a I don't want to say story, but that's quite a narration of what happened to you. So on Mother's Day, I'm sure that year, um, it must be like, your husband and your older child must have been so happy, and you must have been so happy to be there around for them.
Oh my gosh, absolutely. Yeah, I think my whole family, my parents, my husband's parents, um, my husband's mom actually came and lived with us leading up to the surgery because I had a bleed before my delivery, so I had to go live in hospital for like a week in October leading up to my December delivery. Um, so she dropped everything and lived with us for like 4 months to watch my older child and be there if we needed to rush back to the hospital because of bleeding. So to celebrate her and my whole family, there's just so much to celebrate on Mother's Day.
I mean, you're also very fortunate to have such a supportive family who will drop everything for you.
Yeah.
Yeah.
Oh my gosh. So lucky. So, so lucky. We couldn't have done it without them. I'm not quite sure where we would be. There's so many people that had to sort of fall into place from our medical team, our family, um, just being able to get the referral to find the right people and the right resources. And yeah, I feel very lucky, very blessed.
I think, at least from what I'm hearing from this conversation, number one, as a patient, you need to advocate for yourself. You should know
Mhm.
that you knew your risks were higher than other average pregnant women.
Yeah.
So from the beginning, I mean, it was devastating to get the news, but you
Mhm.
and your husband really advocated for yourself and did your own research, and
Yeah.
that is so that's really inspiring to all of us. And
Thank you.
you really faced it, so well, and you had all the support that you needed to get, and you made it through COVID, made it through. Yeah, I'm really amazed that the first one, placenta previa,
I just, you
placenta
know,
playing
it
games.
makes you realize, like, to all the moms watching, every single birth to me is a miracle,
Right.
because my story is crazy, but I have friends with other stories of other things that, didn't go as planned and were completely different situations. And even where they do go really well, it's just really incredible. It is such a miracle.
So really, the Mother's Day is something that everyone should celebrate because everyone is
Really.
a mother, right? Yeah.
Yeah, yeah. It's all hard no matter how smoothly yours goes. And And then all the hard stuff that comes after, right? Raising
Yeah.
these kids. It's every day. It's a challenge. It's the most beautiful gift. But it's a challenge as well.
So from doctor's point of view, Dr. Saketh, from what I'm hearing is planning ahead, then a big team effort and coordinating the team, right? For
Yeah, I mean, yeah, I would say these are not cases that you want to find out about a week before you deliver. And so that's why I think early prenatal diagnosis is really important. Getting in to see your OB as soon as you know that you're pregnant, getting in, following up, because again, as Desta said, we don't generally make these diagnoses until early third trimester. And so that's why it's so important to follow up. If you hadn't followed up or Mrs. X doesn't follow up and then shows up and this catastrophe happens, could you imagine not knowing about it before? And then, we're always on call for these cases, but that may not happen at every hospital. They may need to call in a specialist and coordinate it. And so, that's why I think that having these kind of big care conferences and these big teams, and, I'm very proud that at my hospital and my group, we have this well-developed, well-oiled machine where they're kind of all of us know how to do them. There are about four of us that are the 0.4 people, and we just do these cases. And now we get cases from all over the Rocky Mountain region to do here.
You already mentioned, but previous C-section is a risk factor, right? So with the increase in the
Right.
C-section, you're seeing that more than before.
Right. So history of previous cesarean section is probably the biggest risk factor. Low-lying placenta, like Desta talked about, extremes of age, multiparity. Those are all things that can cause, that can be risk factors for placenta accreta spectrum.
Which I never knew until I was diagnosed. Like no one ever mentions that multiple C-sections can lead to this. At least not a lot of OBs that I'm aware of that are just doing regular, obstetrics. They're like, okay, next baby, next baby, next baby.
Right.
And not saying, oh, now because you've had the C-section or because you've had two or because you've had three, like here are some of the things that could happen. No one told me that my first C-section was risked anything.
So Desta, when did you join back Holland and Hart? After how many weeks?
Well, thank goodness we have an amazing maternity and paternity leave program. So I got to take 6 months, which was
You deserved it.
fantastic.
Yeah.
Oh, I needed it. I mean, I was in the hospital for 3 weeks, I think. So the first
Baby was
month, I
premature.
couldn't have worked if I wanted to. And the baby was in the NICU too. So we were on different floors of the same hospital for like 3 weeks. And so my husband would wheel me up to the NICU and then back down to my floor. And I remember going into the NICU for the first time when she was 4 days old, and all the doctors and nurses were so excited because they were like, we've all been waiting for you to come meet your baby.
That was a good meeting, I'm sure.
Yeah, it was a
So
special
I know
day.
you both have to go back to work, but I really appreciate and we celebrate you on Mother's Day. And you are a big inspiration to all of our viewers who are seeing. And, I'm sure they're having some thoughts of, how to take care of themselves.
Yeah, that's what I hope, right? I want people to know that, all the things I read when I was researching were really scary. But like Dr. Saketh said, if you know in advance, you're the person in my shoes who's doing all that Googling, even though everything you're reading is terrifying and it sounds like you're not going to make it, you will. You need to just look around and find the teams like this that know what they're doing, have done this before, and just try to get yourself there. If you have the ability, the resources, the wherewithal, call in your village and your family and your friends and the people who can help you to try to get to one of those places. You're going to be okay.
Fantastic. So thank you so much and happy Mother's Day.
Happy Mother's Day to you.
Happy Mother's Day.